All right, really in the home stretch. I think I need to come to you to be stretched. That's what I need to happen.
I already said, come on in tomorrow.
Oh my gosh, grateful to have Debbie Dabbs here. She is with ProTherapy Concepts.
Correct.
Golly, you know, so here we go. I don't know, Flavor, do you have an update? We do not have an update this time, but we do have to have a selfie, Debbie, because as we have said all day, it didn't really happen. Aren't you proud of that, Jenny? It didn't really happen unless
There's
we take
no picture.
Selfie. Here we go. All right.
Yay.
Thank you.
Thank you.
So I'm not sure exactly what we were thinking as we were at the end of this, and I probably have two of the most high energy people that I know that have joined.
Let's go.
Oh my gosh,
Come
maybe
on.
that's what I needed
Let's
at the
go.
end.
Yes, we can do it. All
So,
day, girl.
Tell us a little bit about
Oh, my
what you
goodness.
do. All the great things.
You're so sweet. So I own ProTherapy Concepts. It's an outpatient physical therapy clinic. We offer in-clinic visits as well as mobile outpatient clinics.
Okay.
I do have a strong background in home health, so I loved it. I love going to people's homes.
Yeah.
What happened was all the joint replacements, they got sent to outpatient, and I lost all my orthopedic post-surgical patients. And I was like, what? So I left home care because I wanted to have my joint replacements, and I opened my own practice. But because I loved going to people's houses, I said, I'm going to do mobile outpatient. Nobody else is doing mobile outpatient, and I wanted to still kind of keep that relationship going. So I do mostly in clinic appointments, but what happens is we have patients that maybe had surgery and they're not quite ready to make it to the clinic yet. They only need a few home health visits. The doctors don't like home health because it's expensive.
Yeah.
And rightly so, because they're getting all the services, but they just need the physical therapy.
Right.
So I'm able to see them a few visits at home, and then they can come to the clinic once they're ready. And so then it's a good continuity of care. Patients have the same therapist. We know where they live. We know that their dog is there and is a hazard, or they got 47 steps to get into their house, and that might be a problem. So we kind of know what we're battling when we do that. But then sometimes we too have patients that we see for those mobile outpatient visits that have maybe exhausted their resources from home health. They've had all the home health that they can actually, justify as a skilled service. They don't need the nurse anymore. They just need to continue with mobility training.
Right.
And they're always, we don't have to justify that they're homebound.
Right.
You can go wherever you want. I do the mobile visit as a courtesy and a convenience, because especially right after the epidemic, there was a lot of home visits. Nobody wanted to go anywhere. So I'm like, hey, I'll just mask up and I'll come to your house.
Yeah.
We'll take care of business, and therefore everyone gets their therapy. So I love it. I love the mix up. I love the variety. We're in a small town, so we don't really specialize in one major thing, but we treat kind of everything. Yes, we do joint replacements. We do all post-surgical, shoulders, hips, knees, elbows, fingers, toes. It doesn't matter. We do it all.
I feel a song coming on.
Yes, we do vestibular training. That's a big thing.
Oh.
And I treat dizziness sort of urgent care. Because if you're all of a sudden really dizzy, it's bad.
Yeah.
And you need help quick. And that can happen to healthy people, young people, old people. People get positional vertigo a lot. So if you have vertigo, suddenly call me and I will meet you at the office, because it's very urgent. Because the doctors are great, but they'll give you just pills and say, okay, we'll go to PT. And I don't want that to take you a week to get in. That's something that we triage to the front, because if you're super dizzy, then your risk of falling and getting hurt, and you just feel crummy and you're scared to death because you don't know what's going on with you.
And people, I got to interrupt just one second. This is a rabbit trail complete, because I had no idea you did that.
Yeah.
My dad has Meniere's disease.
Okay.
He has been dizzy every day of his life.
Oh, I hate that.
For about 32 years.
That is awful.
But all of the things that they tried, they actually went in and clipped his vestibular nerve.
Yes.
Trying to kill the balance system on that side of his brain, right?
Okay.
And he went to balance rehab.
Yeah. Yes.
That is a thing.
So, right. So, therapy is always about balance, which is fine because we treat all the people that are falling, and, as we get older, we get a little bit goofy. So we got to keep those skills up is one thing. But with dizziness, what happens is if you have this episode of dizziness, that whole vestibular system gets weak. And it's just like if I hurt my arm and it's weak and I don't do this a lot, well, then this gets super weak.
Right.
Same with your head. If you're dizzy, you're not going to do this a lot.
Right.
And so then that system gets weak. And so in vestibular training, we work on your balance, but we also work on your eye movements. And then we work on just turn your head, turn your head, turn your head.
Wow.
And they're like, whoa. Of course, we do it in a safe situation. And they're like, I feel so dizzy. I'm like, that's great. It's working. Because that's how we strengthen the system. Just as if you were going to go boom, boom to strengthen your arm. So you have to stimulate the system to make it work. We do it sitting and then standing, and then I love cartwheels and handstands and as many different things as I can get people to do.
Yeah.
Like they never would believe that that's what they do. So it's fun. I love it. I love every bit of it, and I love seeing people get better. So,
you know, we've talked a lot with different people today, and of course, the majority of the hospice patients that we take care of, we're taking care of them in their home.
Yes.
But there's been a lot of conversation around aging in place.
Yeah.
Which is what I think most of us want to do.
Right.
I don't know a lot of people that say, hey, no, I'd rather go to a skilled nursing home or, you know, go to back and forth to the hospital. But it sounds like a lot of what you do in your home visits goes along the same lines.
Absolutely.
You're trying to improve quality of life to help them stay there as long as possible.
For sure. So our kind of tagline for my company, for ProTherapy, is where movement and function meet. And so we're very functionally oriented. Like you tell me something that you can't do, and I'm going to figure out a way for you to do it. So one of my big things is almost every person gets a floor transfer goal. Like, you know, you imagine people come in, I'm like, when's the last time you were on the floor? And they're like, I don't know, 5 years ago or whatever. And I'm like, well, what about the grandkids? Or what about going to the beach? Like, you've got to get on the floor. And there's a lot of research behind like longevity and the ability to get up from the floor. Whether it's with your hands or with a table or anything, you got to be able to do it. So almost everybody has to do that before they ring the bell and leave us.
Wow.
And so we'll come up with strategies. You know, I teach tumbling there too for the little kids. So we have mats and bouncy pads and all sorts of things. So we'll make you safe and comfortable, but we're going to get you on the floor and we're going to get you up. And then we're going to practice and talk about, you know, if you were down, how do you avoid calling rescue squad? You know, how can you get up if nothing's broken? Or how do you tell your husband to help you up? Because we don't want people just like, okay, they couldn't pick me up. They don't have to pick you up.
Right.
You've got to pick yourself up.
And you may wind up with more of an injury from that, right?
For sure. Now, the next functional task that we like to do is, you know, squats. So we love squats, and everyone's like, why do I have to, you know, squat? 2 reasons. Number one, when you sit down and get up, I always like people to be able to get up without their hands. And I remember the times, like when you sing in the choir, you open the book, you get down and you get up. Well, way back when, all the books came up together, so you couldn't like push up with your hands. I'm like, okay, you could get up then and hold the book, so same. And then the next one is when you go to the public restroom, you don't want to sit down and you're doing that little toilet hover thing. I'm like, toilet hover all day. We got a toilet hover. Keep your legs strong.
Oh my gosh.
So, yes, we got to keep everybody super mobile and moving and all the things.
It just impacts everything, but the quality of life would be much improved.
Absolutely. Steps, bathrooms,
I'm going to have to make an appointment.
beds.
I'm going to have to make an appointment for sure.
Come on. So we just started our stretch therapy, and that's what I was thinking of you for tomorrow. So also in our facility is at NC Reps, which is the personal training, sports performance, tumbling, nutrition, laser weight loss, and now stretch therapy. We have 11 providers now certified to give the most amazing stretches from head to toe.
Wow.
So it's not a massage, it's a stretch. And so you come in, you lay on a table, you just lay there, and we go through every joint. Ankles, hips, knees, the whole thing. And then you feel like super relieved after that. We'll find a lot of asymmetries in your posture, in your motion. And that was the kind of the gap where we picked up when, let's say insurance will quit paying for therapy, but you still need a little bit more. So we can do the stretch therapy for a good recovery, and also our personal training too. So loving the stretch, and we've started our pre-sales and consults right now. Pre-sales going to December 15th, where there's like no, you don't have to pay, if you buy a package, there's no cost for it until December 15th.
Gotcha.
So, and then consults.
So do you need a referral for something like that?
You
Or
don't.
can you just pick up the phone and call yourself?
Nope. So our whole the NC Reps entity in our building is all just cash-based. It's not insurance-based at all. So you can come for training, nutrition, laser weight loss, stretch, tumbling. Do all the things.
I'm probably not going to sign up for your tumbling class,
Come
but this stretch
on.
thing sounds pretty
The
interesting.
stretch is
to me.
amazing. So we had to bring in, when we got certified, we brought in like real patients because we spent like 10 hours stretching each other. And we're like, okay, tired of y'all, but bring in some people that are actually, you know, like patients, even though we're all falling apart too. But so they came in and we got to stretch them all and then kind of get their testimonials. And they were like, amazing. I mean, you just feel like $1 million because you'll find like weaknesses or deficits somewhere that you never knew you had. Like if you lay your arms back, you're like, well, this arm like hikes up like this and this one lays down and you're like,
so therefore I don't do it
like
anymore.
your hip will probably be like, my hip's like this instead of like that. And so it's a good, you can be really self-aware when you're doing stuff like that because otherwise, when else do you go through all your range of motion? And a big comment that people were saying after they came in as patients, like, I have not been in that position in so many years. Of course they haven't.
Right.
It was good. I love it.
Oh, well, that is interesting. So, well, let's talk a little bit. We have a unique partnership with Ancora Compassionate Care and
like me and
ProTherapy. Yeah, just
we
like us.
We can talk about that?
We can.
Oh, yeah. It's one of my favorites.
So, let's just talk about what you do, because people actually don't realize, and I guess they don't have a reason to realize it, but even under the hospice Medicare benefit, we still offer short-term PT, OT, and speech. So most of the time, now you can certainly correct me with what you have seen, but most of the time it is, what are we doing for quality? You know, we're not looking for this to be a long-term situation, but this is more safety, maybe with safety with transfer, bed chair, bed to bedside commode, whatever. So what sort of things do you do for
I'm so
our
glad we get
patients?
to talk about this.
Yeah.
So function, human being, life. I'm a physical therapist. I like to think smart, but I also like to think, if you were my mom, if you were my grandma, what do you need to do? And if that's the caregiver and that's your spouse taking care of you, what do they need to do? And how do we keep everybody around you safe? And how do we make everybody around you smile? Because number one, we don't want you to fall. Number two, we don't want you to just lay there if you don't have to. You've got to get up, brush your teeth, eat a meal, if that's in your wheelhouse. And if it is, we're gonna find that. And we're gonna find a way for you to do it and to maximize your super functional potential until you can't. And when you can't, we're gonna talk about what's next and how that's gonna be like an okay part of your world right now. And we're gonna make the very best of, you know, if all you can do is sit up in the bed, fine, we're gonna sit up in the bed.
But let's do it the best you can.
And we're gonna do it the best we can, and we're not gonna hurt anybody's back along the way. We're not gonna rip your skin along the way, and we just educate everybody on, you know, what makes it better for the whole household. And it warms my heart so much to go in and just, you know, they're just like, wow, here I am in this bed, what am I to do? And I was like, what do you want to do? And we're gonna try and do it.
Let's try to get you there.
And if we can't, we'll find out together that we can't, but we're gonna make the very best of it and come up with something different that will make you feel important, included, and worthwhile. And it's just really fun to see the patients and the caregivers all just, you know, love on those people and make their world much better. So
absolutely.
I appreciate that partnership.
Oh my gosh, me too. And
I love it.
You know, our mission, be a supportive presence for life's journey, but you working with the patient, that is also supporting that caregiver that's in that home. Oh my goodness, just the peace of mind of if we can be a little safer, if we can be a little more mobile, but that all goes back to quality of life that we're improving.
For sure, for sure.
So we had somebody earlier today that shared their personal hospice story. And they actually had a loved one come to Gibson House. Very appropriately. And then her words, she graduated from hospice, which is fantastic. So you do come to Gibson House
Yes.
and do assessments, and people graduate.
They
from hospice.
graduate and they're like, unbelievable. Like, hey, you're good. Let's go.
Let's go.
Round
that is-
two.
Exactly.
Round two.
And so that kind of flies in the face sometimes of the misconception that you call hospice in, and it's always
Sure.
immediate death. Not the case.
God's got the
Not the
final
case.
say.
100%.
So here we are. We just keep going, right?
Yep. 100%. Well, I can promise you I'm calling for the stretch class.
Yeah, come to stretch.
I'm coming to stretch.
We'll hook you up tomorrow.
Okay.
I know some people.
It sounds like you do. And so I need to know these people too.
Yes.
So I appreciate our partnership. I love all that you guys are doing
Thank
at ProTherapy
you.
Concepts. And
You're so welcome.
I appreciate the time.
Yes.
Yeah.
Thanks, Lynn.
Thank you.